About 1/3 of women between the ages of 50 and 74 are not getting their regular mammograms. That's according to the latest numbers released by the Centers for Disease Control and Prevention.
Researchers found that cost was a factor, but also the more health-related social issues a woman has, the less likely she is to get a mammogram. And joining us today with more is Dr. Jason McKellop. He's a breast radiologist and medical director at Breastlink Women's Imaging in Tarzana. Thanks for joining us today.
Thank you so much for having me.
All right, let's talk about the CDC research in a little bit. But first, what are the stats on women who get breast cancer in their lifetime?
So regardless of how many times I hear this statistic, it still shocks me to a degree. 1 in 8 women in their lifetime will develop breast cancer, and that's a staggering number to consider, knowing that we all pretty much know about 8 women in our lives, be it family, friends, loved ones. So to think that 1 in 8 will develop breast cancer in their lifetime is awe-inspiring.
Yeah, it really is.
Of these women, 3 will ultimately die from breast cancer, and that accounts for about 40,000 deaths related to breast cancer in the United States on an annual basis, which is also an unfortunate statistic because we know that with early screening we can prevent some of those deaths. And as the CDC study points out, 30 to 35% of women are not getting appropriate screening.
Yeah, so mammograms, of course, are a key screening for breast cancer. So let's go back to the study. What factors are preventing women from getting them?
Yeah, so there are a host of social factors that can contribute to a patient not getting appropriate screening. And this falls under an umbrella of social determinants of health. These are adverse social conditions that may prevent women from accessing adequate health care. And those can include cost, as you had mentioned initially, but there are other factors as well. Women who feel socially isolated, women who cannot access transportation readily, women who have food insecurity or housing insecurity. All of these contribute to women not accessing health care appropriately. So basically what the CDC did, they did a survey of women and they asked them questions specifically in the last 12 months. Did you have trouble paying rent? You guys had pointed out the rising cost of rent earlier this hour, and that could be preventative in terms of accessing health care. Did you have trouble accessing transportation or food? And when they looked at the responses to these questions, there was an inverse correlation, meaning as many times as those questions were positive, there's a decrease access to healthcare and decrease in screening mammograms.
All right, so I've seen this number change over the years. It's gone up, it's gone down. What age should breast screening actually begin?
That's a very good question because the U.S. Preventative Task Force just within the past 2 weeks has readdressed this question and has lowered the age to the appropriate age of age 40. Women should get breast cancer screening starting at age 40, and all of the studies that have looked at the results from screening point to annual screening at age 40 and beyond. So average risk women starting at age 40, if you're at high risk, potentially starting 10 years earlier.
And then there are different types of mammograms involved in screening. There's a screening mammogram, there's a diagnostic mammogram. What's the difference and why is that important?
So screening mammogram is our bread and butter screening utility. We do 4 standard views of the breast, and women come in and out of our facilities, get these standard views, go home and get a report later from the referring physician. A diagnostic mammogram, in contrast, is a tailored study that looks specifically for a particular clinical complaint. If a woman comes in with a palpable lump or breast pain, then that exam is tailored specifically for the evaluation of that complaint, or if a woman's been called back from a screening mammogram to evaluate a specific imaging finding.
All right, there may be somebody out there watching right now and say, hey, this all sounds great. I can't afford this. Yeah. If that's the case, what can be done?
So there are some federal and state level initiatives that have been instituted to address the cost of obtaining mammograms. The CDC, in fact, has a early cancer detection for both breast and cervical cancer screening that can afford women no cost or low cost mammograms. There are also federal mandates through the Affordable Care Act that have instituted low cost and free mammograms for women who do have health insurance.
You mentioned transportation and housing insecurity are both reasons why women may not get a mammogram.
Correct.
So tell us a little bit about your mobile screening mammogram program.
Yes, so I'm very fortunate to work for a company that has this ability to deploy a mobile mammography unit. It's affectionately known as Maddie, the mobile coach. Oh. And this services both California and Arizona. And basically this mobile coach has all the latest and greatest technology, the same technology that we have in our our brick and mortar facilities, and this coach is deployed to various underserved communities and can tackle this problem of access and transportation that we had talked about earlier.
All right, if anybody's interested in sponsoring screening mammograms for underserved women, what can they do to help?
So simply go to breastlink.com and just follow the links to Maddie, the mobile coach, and they can find information there.
That's a great cause to donate to. Yeah. All right. Well, thank you for being on with us, Doctor. If you want to learn more about Dr. McKellop or Breastlink or Maddie, please log on to breastlink.com.
You know, Kai, I know he probably looks good in a lab coat, but man, he looks great in this suit.
Here's your kind.
Sharp.
It is a great suit.
Got it from
Love that
Nordstrom
tie.
Rack, actually. Nice meeting you guys.
Thank
Thank
you.
you for having me on. I appreciate it.
Great information there.